Welcome to your weekly wellness dose, The Wellness Factor. I'm your host, Dr. Noelle, and today we are discussing the pelvic floor and its importance for bladder and sexual health. So, many may be familiar with what that is, or perhaps not, but the pelvic floor has gotten increasingly more attention in the last decade or so as we are aware and have certainly been aware in the medical community its importance as the foundation or the base of our core. So, what is the pelvic floor? Well, the pelvic floor is a group of muscles that stretches from the pubic bone to the tailbone and functions to stabilize the core. The core, meaning the abdominal muscles, paraspinal muscles, the muscle that align the spine, buttocks, pelvic floor, thus stabilizing the spine and the pelvic organs, including bladder and reproductive organs. These are muscles that are oftentimes neglected. Even for my exercise warriors, the pelvic floor is not always addressed. And when the pelvic floor is weak, this can present in many different ways, such as urinary incontinence, both urge and stress. So, urge incontinence is that gotta go feeling. Stress incontinence, when there's a leakage of urine, when you cough, you sneeze, you laugh. Sexual dysfunction, such as erectile dysfunction in men, anorgasmia in women, difficulty reaching orgasm, chronic pelvic pain in women. Factors for pelvic floor weakening can include many things, including lack of engagement, so we're not exercising those muscles, hormonal shifts, menopause in women, menopause in men, yes, men, you too have hormonal shifts, weight gain, obesity causing pressure into the pelvic area, weakening the pelvic floor, pregnancies, previous vaginal deliveries, surgeries, including hysterectomy or perhaps prostate cancer surgery, chronic constipation, persistent straining from passing hard stools, weakening the pelvic floor, aging. Yes, as we get older, the pelvic floor weakens. We tend to lose muscle as we age at a rate of 3 to 8% per decade after 30, and the rate of decline is even higher after 60. So all these things can impact the pelvic floor and its functioning. So how do we address this? Because a weakened pelvic floor really impacts our quality of life, affecting spinal support and thus our movement and agility, our ability to control our bowel and bladder, our ability to enjoy sex. And we should all be able to enjoy sex even into our last days. When we go out, we should go out with a bang. No pun intended. Okay, maybe that was a little bit much, but we should be able to enjoy life for the entirety of life. And we can do so when we make the right choices and behaviors. So, how do we strengthen the pelvic floor? Well, you can certainly do Kegel exercises. So, if you're not familiar with this is when we contract and release the muscles of the pelvic floor. So, if you can pretend that you have to pee or poop, but you don't want to. So, you engage those muscles to prevent that. Or perhaps you imagine that you have a straw placed right in the middle of your private area. So, in the middle of the private area, the straw is placed and you are sucking up through that straw and then release. You engage and then release. And perhaps place your hands onto your inner thigh, buttocks, making sure that you're not contracting those muscles. This is doing a Kegel. And you will continue to do so. You will contract and release several times as tolerable and repeat. I would recommend 2-3 times a day, preferably in the beginning of the day. Now, you can also try pelvic floor exercises or pelvic floor physical therapy. This is an option. I have included a video to complement this podcast on my YouTube channel with a yoga-based sequence specifically for the pelvic floor. So I encourage you to join me if you're so inclined to go through a series of strengthening as well as stretching exercises for the pelvic floor. It is as important to release and stretch the pelvic floor as it is to strengthen, as tight, tense muscles of the pelvic floor can trigger issues such as chronic pelvic pain and anorgasmia, difficulty reaching orgasm. Now, there is a newer technology, the Emsella, that is being used to strengthen the pelvic floor. Have you heard of this? I am quite familiar with this as I have had my practice for a few years now. It is a FDA-cleared, non-invasive approach to rehabilitate weak pelvic floor muscles. It utilizes high FEM technology, high intensity focused electromagnetic energy. Essentially, it is a magnet that exists in the device to directly activate and engage the muscles of the pelvic floor, doing a Kegel for you. And it's so efficient that within a 28-minute session, you would have completed 12,000 Kegels. Now, This is likely not humanly possible to do on your own, but with the activation of the muscle through magnetic energy, this is achievable with the Emsella. There's no pain. It's a non-invasive approach. No device that needs to be inserted. You literally sit on the device, clothes and all, for 28 minutes for your pelvic floor workout. There have been several clinical studies looking at the efficacy of this device and specifically high FEM technology, noting an average of 65% improvement rate in urinary symptoms amongst participants in the studies and a 95% satisfaction rate and improvement of quality of life for those in the study with urinary incontinence, and with more recent studies looking at men with erectile dysfunction and significant improvements made in sexual symptoms after treatment with the Emsella. So, there are many approaches to addressing the pelvic floor, whether that be doing Kegels or specific pelvic floor exercises or using a highly advanced device, whatever you choose. The point is to make sure the pelvic floor does not get ignored, for it is important for our movement, balance, urinary health, sexual health, and really overall quality of life. So, I hope this gives you some clarity on what the pelvic floor is and why it matters. And again, you are more than welcome to join me in the pelvic floor workout I have included with this podcast, available on my YouTube channel. It is now time for our mantra of the day. So if you can close your eyes, focusing on your breath, allow your belly to be soft. As you inhale, the belly rises. As you exhale, the belly falls. I am ready for abundance. To accept possibilities seen and unseen. To claim my rightful position in divine power. I am stepping into my power. The power of the divine. I am abundance. Now you can continue with that breath, with that thought. Or perhaps you've had enough for today. I hope your day is blessed and protected. Thanks for listening. Namaste.